Hi, everyone. Thank you for joining today's webinar brought to you by athenahealth and Health iPASS on conquering the burden of choice, how to select the right patient engagement, check-in, and payments technology for your practice. For those who don't know, my name is Imran Ahmed. I'm the SVP of Growth and Strategy for Sphere Commerce, the parent company of Health iPASS. And for those who are unfamiliar with Sphere, we're one of the leading payments technology solutions in the country. We work with about a third of the largest health systems in the country, from Northwestern University to UCSD to Sutter to NYU Langone. And Health iPASS really works with some of the leading, what I classify as independently owned medical practices, and specifically with a target on the Athena clientele and folks who are using Athena. So today with me, I'm proud to have, and most likely doing the bulk of the presentations, is Muj Akhtar. Muj is the practice administrator for Curewell Primary and Immediate Care. They are a 9-provider group in the Chicagoland area that has been using Athena for everything possible since inception. So Curewell Primary and Immediate Care sees approximately 180 patients a day, is one of the leading Athena practices when it comes to technology adoption. Because Muj has that mindset and really digs through and analyzes and is really a subject matter expert when it comes to tech adoption in practices. Muj completed his undergraduate education at the University of Illinois. He started medical school for 2 years, so I call him a half doctor, and understands the pain points of providers before he left to become a practice administrator and run Curewell Primary and Immediate Care. So I'm going to pass the reins to Muj, but before I do so, from a schedule perspective, I'm going to hand the reins over to Muj. He'll discuss really the detail of the steps that he took to navigating the Athena marketplace, some of the pain points that they had. Then I'll quickly run through a recap, show you a bit more about Health iPASS, and after that I will open it up for Q&A. At any point during the conversations, you can open up the Q&A window and write in a question. We'll try to address those and answer those at the end. So without further ado, Muj, I'm going to pass the reins to you, and the show is yours.
Sounds great. Thanks, Imran. Hi, guys. As Imran mentioned, my name is Muj. I am the practice manager at Immediate Care Curewell. I'm just going to kind of go through the slides here and just jump right in and kind of tell you about how we got to using Health iPASS, how we started without using it, and kind of why we needed to implement it. And we'll kind of just go from there. Obviously, if you have any questions, like Imran mentioned, you can put in the Q&A and we'll try to address it. So let's just go ahead and start here. So that's just our logo, Immediate Care, Health iPASS. Going to start going through the slides here. Conquering the burden of choice. If you guys are on the Health Athena marketplace, we'll get to this slide again in a little bit. There's lots of options here, and we'll get to why my practice chose Health iPASS. Tell you a little bit more here. We have been an Athena user for a couple years now. We were on another PM system, other EMRs, or at least other practices. I've gone from multiple EMRs, at least at other practices, and so I'm pretty well acclimated to how they all work. We love Athena, not switching out, not even considering other PM systems, but we needed help, and so that's why we came out of the marketplace and found Health iPASS. Real quick, we have about 9 providers across my 3 locations. We have everything is immediate care, from pediatric patients to adult patients to geriatric patients. A vast majority of our patients do have commercial insurance, almost 75%, and then the others have about Medicare, Medicaid, or possibly self-pay as well. So to just start here, why did we need to supplement our Athena system with something else? Really, it's we were looking for something once COVID hit. I'm sure some of your practices had a huge decline in patient population when it came to the pandemic. We actually, once testing started, we had a massive increase. We went from about 20 or so patients per provider to a jump in about 60 patients. So we needed something to help us out all over the place. As I said here, tripled and required some kind of digital solution, or then I need to make a bigger building, hire every square foot of my practices with another front desk staff or medical assistant or something. And there had to be a better way to do this rather than just keep hiring more and more employees. So that's why we came on the marketplace. We needed to essentially increase our efficiency from the front end, from the back end for billing, and kind of everything in between. And so I knew there had to be a better solution than just hiring more and more staff and have everything all over the place and a disaster in my in my practices. So that's why we came on the marketplace. I'll tell you a little bit more about how we were struggling here. So basically, we Athena here had very limited. Some of you guys may have Athena Communicator. The reminder options are quite limited. Basically, the reminder is the same no matter what patient is coming in the door, whether it's a physical exam or a very acute infection, or if they're here for some kind of COVID testing. And so the nice thing was we were looking for what Health iPASS provided, but what we were looking for specifically was something that could tailor the appointment reminders to the type of patient appointment that was about to happen. And then we needed some kind of check-in option that could happen prior to the visit as well. For these patients, so that they could see their copays and possibly even what the visit would cost, including their current deductible level, if they've hit their deductible, if they've not, things of that nature. And a big thing, obviously, when you triple your appointments, you also are trying not for the patient to wait 30 minutes, an hour, especially in kind of an immediate care center. There's a reason why they came to us rather than waiting at their primary care physician. I'm sure even if you guys are primary care practices, whoever's watching here, I'm sure you don't want your patients waiting in that waiting room for an hour. So we were trying to reduce wait times. And then obviously from a financial perspective, we wanted to collect those dollars from the patients. Some of them, it was okay. The copays usually aren't a problem. Most of the patients know they have to pay that. But, on the back end, you have this issue with those who have not hit their deductible needing to actually pay that after the visit. And so we needed a way to actually collect those dollars back and not have, I didn't want to double my billing staff for them to, go out and try to reach these patients and, send multiple statements. So there needed to be a better solution for that. And, like as I said, I would have to have a lot of more employees, including the front desk. We already started asking them to do more and more. You get that issue with some of them not wanting to mask. Those ones I kind of had to throw out the window, unfortunately, because we're a COVID site. So I don't know why they didn't want to. But again, I was really having them do a lot more checking in these patients, making sure the insurance was verified, making sure we got them all the paperwork that they needed to fill out, especially if they were a new patient. And, when you triple the amount of patients, that gets to be a huge, huge headache for everyone, especially the front desk. Providers, yeah, but they always, have a headache. I feel like they're always complaining to me about something or the other. But that's up to each practice and their own. And so one of the big things was our AR was quite terrible. Our accounts receivable was just, we weren't getting the dollars in the door because they had so many patients and we weren't, sure what was going on exactly. But obviously it was the number of patients that increased. And so again, we were collecting the insurance dollars. That actually wasn't a problem. The insurance was paying us, we were billing. But the big issue here was the patient dollars, those who had not hit their deductible. We needed to collect that money back as a practice. And that wasn't happening to the efficiency, obviously, that we wanted, but it was just got worse and worse with more and more patients as we increased. So I needed to find a solution for that. And again, I couldn't just keep hiring and hiring more staff and, crowd up my whole practice. So we started looking for a solution. We went to the Athena marketplace for that bottom line. we needed something to help us from a technological standpoint. And so we went to the Athena marketplace. If you guys have been there before, there's lots of options there. And you get everything from, you may have heard of Freesia to Epion to, as you can see in this picture, there's quite a few here. And at first, obviously, kind of like Amazon, you just look at the ones with the highest rating or the most reviews, and you're kind of like, that's got to be the one. But, sometimes I'm sure you guys have had experience buying something on Amazon. You kind of come to your door and then you see, this wasn't as great a quality as I expected. And so I decided, you know what, I really have to dig deep and see what the options are here. I'm not just going to go ahead and pick the one that everyone else picks. I want to make sure that this is the right solution for my practice. And, I'm not just going to dive in and just hope for the best here. So I went in and properly evaluated multiple of these options in the Athena marketplace. And the big thing also was I needed to talk to my staff, the staff that's been with me at these practices for quite some time. I had to ask them, like, hey, I thank you for your help in, dealing with all this increase in patients, but what can I help with? Where at the front desk can we increase our efficiency? Is it just the check-in, the demographic information, or is it something with the forms? Or is it something with, collecting the copays? Where do you need help? And I did the same with my clinical staff. Listen, I know you're seeing more and more patients. What is slowing you down? Is it actually the patient visit? Or is it just that first initial intake that my medical assistants do with, collecting the very basic allergies and, whatever they tell before seeing the provider, whatever they tell us, is that what's slowing you down? Where can we increase the efficiency? And so I think that's something that I'm sure you guys are already dealing with as why you're on this presentation. But that's something you definitely should consider rather than just making a change for the heck of it, or, thinking that you can just make the change and it'll happen. Definitely you want to talk to your staff. So the big issue or the big subject that came to mind was it needs to have a very good integration with Athena. You're going to have all these options out there, but do they actually function in a way that, writes into Athena the right way? Is it all just going to be these forms that, somewhere we have to look for it in the, in the find button in the chart, and we don't know where it went. It's somewhere there, but my staff can't find it. And so I needed to make sure whatever option we chose, it was going to help my front desk. It was going to help my clinical staff. And obviously it would help my back end staff as well with the billing. I just needed to make sure that it was something that would help all around. And we weren't going to change our PM system. Athena, we loved, we still love. We're not going to change it to whatever else is out there. We just needed a better technological solution to help. And one of the things was obviously this discrete data. We want to follow HIPAA guidelines. We want to get the information into Athena in a proper, secure way. And it shouldn't just be some form somewhere that we can look around all around Athena and somehow find it in the patient's chart. We want it to be properly put in. One of those things, obviously from my provider and clinical staff standpoint, was the history of present illness and review of systems forms. Those are pretty important for the most part. Those are written directly by the provider, but there are parts of that could be done ahead of time by the patient. Many of you guys, I'm sure, use paper forms to give to each patient, but we weren't looking to constantly do that, especially when we tripled our patient volume. The amount of scanning that would have to happen, the amount of writing that would have to happen from my my clinical staff, it was just overwhelming. So we needed something that would write properly into Athena, and we were looking for a solution for that. Many of those options that you have in the Athena marketplace, they're really good clinically to do that, but unfortunately then they kind of lack on the the billing standpoint for the payment options. They won't be as good with collecting the dollars after the visit, giving those reminders. They might help with your copay, but they won't do the card on file option. They won't show the patient cost for the visit. And again, our AR was not from the copay. It was from those patients who had not hit their deductible, and we needed to collect those dollars. So we needed, an all-around solution, clinical as well as from just a payment financial perspective. And so the nice thing was there was Health iPASS, which I'll come to a little bit more, that was customized forms. The HPI ROS forms, you can, however you guys want to make it, however we wanted to make it. As a practice, I could give that to Health iPASS, and they would completely customize it to the questions I want asked to the patient. And those would all write directly into the Athena chart for that patient. And that's obviously what my providers wanted. My bosses are the providers and the owners of the clinic. That's about it. And so I have to report back to them. Owners obviously just care about the financial side. Providers only care about the clinical side. So I had to find a solution that would do both and not just one. And so we looked at all this for all the different options. And as I go forward, end-to-end solution, we needed, for my front desk standpoint, what kind of appointment reminders so patient would know, we would know what kind of appointment the patient was scheduled to have. We needed them to have a digital check-in option, so my front desk wasn't just overwhelmed with, performing eligibility checks for insurance, so that they would get the forms directly into the chart. So my front desk wasn't just scanning every single form like they were prior to us bringing in Health iPASS. The insurance verifications, it's a very cool system. I'm not sure if Imran will show you later or not, but your list of patients who are already scheduled for the day, you can just hit perform eligibility check once, and it'll just run through that whole list without going to each patient's chart or each patient's quick view and performing eligibility check for each and every single patient. Very awesome feature that my front desk obviously loves. So they're not sitting there getting into each and every patient quick view and clicking whatever home phone for the contact preference and all these little things. You can just go ahead and perform all the eligibility checks in one foul swoop. There. And then obviously, like I mentioned, the patient payment collections, and afterwards, the billing that has to happen. They should get reminders, it shouldn't just be a paper statement. So it should be some kind of email and some way for the patient to pay quickly. Some of your practices, I'm sure if they're geriatric practices or something of that nature, patients probably don't like that. But for the most part, patients do like having an electronic or reminder. And so it's kind of nice to have these emails and text options for the patient to pay. Of course, if they have a card on file, our patients just receive a reminder that, hey, we're going to charge your card now this much money because you haven't hit your deductible and this was the cost of the visit. And here's just a reminder that we're going to charge that card. So we weren't trying to move away from Elevon or anything of that nature that Athena uses. We just wanted to collect those patient dollars. Moving to the next slide. I apologize if I'm talking fast. I'll try to slow down a little bit. I'm kind of used to talking at a little faster pace with all my staff here. But big thing, obviously, here was cost. I have to make sure that everything I do as a practice manager, practice administrator, is it worth the cost? I have to get a good return on investment. You guys are, I assume everyone here is an Athena user. So Athena collects some percentage of your revenue to utilize Athena. And then on top of that, these options that were in the Athena marketplace, they're also going to collect a certain percentage. And, I don't want to lose that percentage if it's not worth it. And so that was my big thing. So I had to go through, as I mentioned in that earlier slide, with all my staff, see where they needed help. See, obviously, if my higher ups are okay with losing that small percentage to make us more efficient, or did you really want me to hire, 20 more people so that we could do all this work and crowd up my clinic. But now at least we got the billing done, and now at least we got all the front desk stuff done in a more efficient way. And so our options were definitely go down the technology side rather than more and more employees. So for us, it was definitely worth the return on investment here with utilizing Health iPASS. We didn't want to bring on a third-party vendor initially because obviously we're trying to save our costs. But again, with our increase in volume, with our just my front desk being overwhelmed, it was just worth it. I honestly think even if we didn't have this increase in patient volume, this was still a good option to find a technological solution so that I just help at that front desk, at that back end, my clinical staff, providers, everyone, just finding a solution that could just make things more efficient. And so we had a great option here when we brought on Health iPASS. They provided us personalized support. It wasn't one of those things where, you can't ever contact anyone. It's just some big company that will never really help you. I'm not sure if you guys ever try to contact Amazon or Walmart and actually talk to someone. Doesn't really happen. Can't actually reach anyone maybe after an hour on customer support line or something, but that wasn't the case here. Health iPASS gave us a dedicated support person we could contact anytime, and they would help us run through any issues or whatever was happening that we couldn't figure out with the Health iPASS platform. And right away I could get in touch and it was just fixed, or we learned what we had to do or what we were doing wrong. And so that was a perfect case for us. Going on, as I mentioned, after considering all the options, we did choose Health iPASS. And let me go, what they appealed most to us, kind of what I mentioned before, what we were looking for, and it ticked all the boxes here. Amazing integration with Athena, forms, clinical forms, payments that have to be made by the patient, the insurance verification, all these things, as I mentioned, were just amazing. I didn't even know that there was an option for this. I probably would have brought on Health iPASS way before if I knew that there was such a solution from a technology standpoint that could save all my staff just, time. Time is money, and so it saved us an amazing amount of time to bring on Health iPASS. All that data was written back into the HPI and ROS, like I mentioned earlier. Patients could check themselves in, auto-arrive, and just cost-effective from every standpoint. You can see in the middle there that middle picture is kind of a kiosk. If you see, it's like an iPad. Obviously, those patients can use their phones to check in as well, the top and bottom picture. But inside of our clinic, let's say you have those older patients walk in and don't use smartphones, there's also iPads where they can just kind of check themselves in without going to the front desk. They just come on in. There's a big kiosk platform there. They can put in all their information if it's not already there. They can see what their copay is. They can even just go ahead and swipe their card for that copay without even bothering my front desk. Obviously, your front desk should have very great customer service skills, but the idea here is that you don't want them bogged down with a million things. And so one of the nice things is they can just do it all on this iPad or their phone, and then just come in and sit down. And we know, my front desk knows that they're here, they're sitting down, they're ready to go for their clinical visit. Moving forward here, these are some of the results that we had using Health iPASS. So because of them, because of the assurance verification and everything else that would be done by the patient ahead of time, there was a 52% reduction in denials. I'm sure some of your billing staff has dealt with these kind of problems for demographic info or whatever else is incorrect from the insurance standpoint. And then we had an increase in that patient collection, which is obviously ideal here. Is what a lot of, I'm sure you guys are looking for, patients actually paying their bills. And so that was great. That's what we wanted. That's what we're looking for. And so that's what we've seen so far. I'm hoping these numbers go even higher. But again, that's what I needed, a solution, and this provided that. Clinical efficiency, obviously, the HPI and ROS forms were put in from a directly text. The text itself came into the patient's chart. Big thing here, check-in times. Sometimes I'm sure if your front desk is bogged down, they're giving forms to patients, they're getting those forms back, scanning them in, whatever it is, however your practice runs. I could almost do all of that before the patient even showed up. They'd get that reminder a day before or a couple hours before, however you guys want to tailor make it. Health iPASS can help you with that on the timing. And so those patients, all that info was in before they even stepped foot into our clinic. And things were just done and ready to go. Obviously, that last bullet point here, none of my staff likes changing. I don't know if any of you guys have ever changed PM systems or made a big change in your practice in general. It's not very fun because everyone likes the way things are already running. Even if it is more busy, to learn a whole new system is obviously not fun. But once you kind of get the hang of things, it gets better and better. And then someone realizes, like, wait, this is actually a better way to do things. So at the beginning, there's always that reluctance. That's what happened with my staff. No, I'm not going to lie about it. They didn't like it. They just straight up did not like it because, they're used to going into each patient's chart, going through the quick view, making sure everything is in properly, performing the eligibility check, knowing that, this paper document is here. I have it on, in my physical chart folder, Manila folder somewhere, and that wasn't happening anymore. So they were like, what's going on? Where do I find this? Maybe even the provider was like, I want to go back and see it. And so it takes a little bit of time. Obviously, not everyone's happy, but at the very start. But then, once we figured out that this is how it's going to be in this section of the patient chart, it made things a lot more efficient. And then over time, especially my front desk, I should say, liked it quite a bit once they realized how much Health iPASS was helping and aiding in our whole process. And then there's a client success team that Health iPASS provides for us that we can contact anytime. Again, you'd have a dedicated person, but for whatever reason, if that person isn't there, there's always someone to contact that can help you. And again, you'd be very likely using this at the beginning if you guys decide to utilize Health iPASS. They are very good about coming and teaching you and teaching your front desk how to do it. And they came in person for our practice. I'm not sure how that works for different locations, but you can I guess talk with them about that. They were able to teach us exactly how to utilize the system and just kind of go from there. All right, I'm going to move forward here. So the final takeaways from using Health iPASS, right choice for your practice. So one of the things I should say, as an immediate care, we do have patients walk in the door. So for that reason, it's not as useful, Health iPASS, for those ones who walk in the door, because my front desk kind of has to do this anyway and put in the information. But all that billing stuff can still happen on the back end, as far as sending them reminders, sending them their electronic payments, text messages or whatever it is. But from the standpoint of them, of checking them in, if they walk in my door, there's not really a need to have them checked in ahead of time as immediate care. But I'm sure some of you guys are specialized practices or primary care. So it's a return patient or it's a patient you knew was coming ahead of time. And so for that reason, it's obviously very, very good. And just some key points what you guys should consider if you are looking for a solution. Find out, as I mentioned in a few slides back, talk directly to your staff. Where do they need help? Where can they have some more efficiency? What's bottlenecking your practice? For us, it was the front desk. It was 100% them. They couldn't check in the patient fast enough. They couldn't get the forms in fast enough. And that's where Health iPASS helped quite a bit. And then obviously a huge portion was obviously my back-end billing staff. Now they realized that they were actually getting dollars in the door. So I was happy. They were happy that they didn't have to do as much work. And then obviously the owners are just money makers, right? So they're happy that money is coming in the door. So it was definitely the solution for us. I think I am kind of good from here. I'm not sure if Imran wanted to bring on anything else.
I am. Thank you so much, Mustafa. First off, I appreciate you taking the time.
Sure.
It's a process for sure to go through and look at all the marketplace contenders, and you're one of the few people I know who took the time to really go through every one of those, and it's fantastic to just have you have that. I actually didn't realize the 42% increase in patient revenue, which to me really stuck out as a great indicator. So for anybody who's interested, what I was planning on doing next was just to go over a very high level overview of Health iPASS. And then if you do want to ask any questions, Mujtaba is around and we can answer those questions. Just please put those in the Q&A. I see we do have a couple of questions that have come in. So I'll give you a couple minutes to compose those, and we'll go over those right after I run through a quick demo of the product and what we actually do. So with that, you should be seeing my screen at this point, really talking through Health iPASS. You know, what we really push, and our whole MO as a business, is how can we drive better check-ins for the practices that we work with and really push better revenue. And to do that, we've realized that we need to engage with those patients at all elements of the patient journey. So for us, that means before that patient arrives, as Mudge really went through, the process of sending appointment reminders and engaging from that point forward to get the patients in a journey to complete a check-in process is what we really try to do. Supplementing it with the ideas and the impact that we have at the point of service to allow patients to check in mobily, as well as to allow them to check in via the kiosk. But utilizing the information that we collected at the front end of the house to drive the post-visit collections. And I think that's a unique element for us or a unique element that Health iPASS has, where we do full e-statementing, e-billing, text to pay, but we're utilizing the cards on file that we captured at the front end of the patient journey. And we're getting about 50% of our patients who check in on Health iPASS to put a card on file. And so it's really high adoption. And if you could automate the statementing process and the collection process from those patients, that's really what we push. We do also have, obviously for us, it's how do we maximize the collection opportunities that are at every stage of that journey. So from pre-arrival to check-in to check-out, even with a cost estimator solution, e-statementing, et cetera. But we start our patient journey with scheduling. You can use Health iPASS for self-scheduling, if you will. It's meant for more complex practices to be able to make an appointment request, have the patient go through, select who their provider they want to schedule with is, have a button on your website, and have you as a practice be able to manage that flow of patients. But that's really not a core piece of what we do, and everything that we do is very modular. So you can say, I want the Book My Doc self-scheduling solution or not. Because really what we start that flow with is the appointment reminders I mentioned. We can do email, we can do SMS, we can do voice reminders. But what we use for those reminders is a very personalized journey. And we could start that patient based on if they are a COVID patient or not, based on if they are here for a surgical follow-up or not. We can send the patient down a different journey just based on appointment type. We can customize it by payer type, location, deductible, et cetera. And it also has things that are, I think very useful, like bulk messaging. If an office shuts down for a day, you can do that. If a provider's sick, you can send a message to all of that provider's patients for the day. So those are all aspects that we cover in that appointment reminder. But the appointment reminder at the end of the day is really meant to drive our express check-in experience. And so you'll notice here that I've got this link that's embedded. That link that's embedded within the appointment reminder would take me to the express check-in. And this is a mobile experience. You'll notice that there is no username. There's no password. I don't have to log into a patient portal. It's enter in your date of birth, verify you are who you are, and then we're going to pull in your specific demographic details from Athena. We're going to allow you as the patient to edit those details. And this is what Muj's practice uses quite extensively, where they saw that reduction in insurance denials due to demographic errors. And all changes right back in real time into Athena. So you're not having to toggle back and forth. And I'll show you what that looks like in a second. We can do things like primary language. We can do things like emergency contact. You can add things like pharmacy. You can add referring provider. I mean, there's a whole host of different modules that you can sort of include here to allow that patient to edit those details. Upload a copy of their identification. All of those drop seamlessly back into Athena. Upload insurance information and run insurance eligibility on that patient in real time. So if a patient had a change, for example, in their insurance, they changed employer, you can edit that information. You can take a picture of the front and back of the insurance card. And what's really different for us is that image actually gets put into the proper place in Athena. As much about sort of identify, I think, Mudge, you guys were using Solve before, and one of their integration pieces that wasn't flowing over was something like the insurance card. And so those are the nuances of the integration that we have with Athena that are very distinct, and being able to show that patient their benefits for the visit, and give them a visual indication of that before we drive them to a payments experience. And the payments experience should allow that patient to deselect, select, all of these things are customized based on what you want. We'll show the patient what their balance detail is. They have the ability to drill in to that past due balance so they can see what those balances may or may not be for. You can do deposit rules, like if it's a self-pay patient, always collect $150 deposit, or whatever rules you wanted to put into it. And to give that patient an Amazon-like payment experience where they can pay with a card on file or pay with a new card. But you'll notice that we do encourage that patient to keep that card on file for future use or turn on auto pay for that visit only. And so I shouldn't say and turn on auto pay for that visit only. Because what we're seeing is when we can get that patient to put on a card on file, it's just easier for the patients to be able to turn on auto pay. Say, if there is a balance, don't chase me down with 3 statements and figure it out. I'm already giving you permission to use that card. And then Health iPASS engages in a full set of e-statements, e-bills, text messaging to really engage the patient post-visit. 3 weeks later, after the visit, how can we engage that patient to get them to pay their bill? And it's, more as you use the Amazon experience, we try to give an Amazon-like payment experience to completing that check-in and payment process. But really, where the meat and potatoes come in at the end of the day is forms and intake. And being able to take any of your forms, and I say any of your forms, and provide those to the patient. So these days we've got COVID screeners and medical history, social history, whatever forms you want, you can have those presented to the patient, have the patient be able to sign off on those forms. And what's great about the Health iPASS integration into Athena is that where there is a discrete field, we are going to populate that form detail in that discrete field. And I'll show you what that looks like in a second. But at that point, you're checked in as a patient. But just to give you a sense of what that looks like in Athena, if I changed my demographics or my family history, it's actually reflected and pulled into specifically the specific fields in Athena. So you'll be able to see PDFs of forms, but if I've completed my family history or surgical history, it's actually going to go through and complete the clinical chart. So if I said I smoked 2 packs a day, my social history questionnaire, that would be able to be reflected here back into Athena. Medications, etc., all of those details, you can see how those get displayed in Athena, including demographic details. So with that, I'm actually going to stop sharing my screen, and for the most part, my demo part is completed. The only part that I'll sort of conclude with on the Health iPASS demo side in Athena is that everything that we do is supplemented, and I'll revert back to my presentation, is supplemented at the point of service with a kiosk solution that we can give you guys at the front end, designed to be a 60-second check-in kiosk. Really a very simple way to update demographics, review insurance details, pay balance amounts, etc. But really, we have a couple of unique features, like a full-on cost estimator, specifically for surgical groups or people who want to collect before that patient checks out, to be able to enter in specific CPT codes and present to the patient a cost estimate before they leave that takes into account their insurance. You're also able to collect on that. And then, as I mentioned, that full e-statementing and e-billing process. But I'm happy to go into details with any of you individually who have attended. I wanted to thank you for your time on that. And I'm going to ask Mudge to come back on screen to go through the Q&A that we got. So Mudge, just thumbs up that you are there and can hear me. All right, perfect. So Mudge, we do have, I think, a handful of questions. Most of these are directed at you, so I apologize. I'm the more boring of the individuals. They're mostly directed at you. But Mudge, first question that came through was, how many vendors did you evaluate on the Athena marketplace, and what features and capabilities were important?
Okay. I would. Ooh, that's a hard one. I'm gonna say at least 10 or so. There's some smaller ones out there. There's some bigger ones out there. I can't say I know the exact amount, but it takes some time to go through each one.
Did you do demos with every one of them at the end of the day?
Yes, I did ask them for demos because each one kind of showed me, I just needed to know what they could and could not do. So I definitely went through demos with them and just to see what they could integrate, what they couldn't integrate. And kind of what I mentioned before, a lot of them were good with the copay part. And possibly even some of them were better, other ones were better with that clinical part, but there were very few that could do both the clinical right back into the chart and then also the payment collection afterwards. And so that's what we're looking for. I needed something that did both. I wasn't going to have like 2 products or something of that nature, right? So I needed to make sure that I could get the non-clinical side and the clinical side covered all with one product.
Got it. Yep. No, that makes a lot of sense. The next question that we have, actually we have 2 questions on this. What was the implementation process like? How long did it take?
Yeah, so the implementation, they were pretty good with coming on, I want to say, within a week, I want to say something of that nature of us getting the platform. Like I said, it was a little bit tough with the initial startup, not from their side, from my staff, because they were pretty reluctant to try something new. So it took at least 3-4 days for my staff to get used to it, and obviously I had multiple sites, so they had to go and kind of teach at each site. Obviously, you can have your Zoom calls and everything online, but It's just not the same as in person. So they were willing. I don't know, Ron, you can talk to how possible that is for each and every practice, but they were willing to come, your team, to each of my sites and teach my front desk. It's not so hard for the clinical staff. It's actually really easy for them because they're just like, oh, cool, I have stuff written into my chart. And so they're happy. So there's nothing for them to go. But I know sometimes it takes longer. I think for a bigger practice, it can take like 3-4 weeks. Again, for the smaller ones that we had, I think they did it quicker. I think you just have to talk to your Health iPASS sales rep or whoever, I don't know, whoever that was, that can kind of help you with seeing how long it takes to go live.
And I can jump in. I mean, for everyone's benefit, in general, we say to allocate at least 6 weeks for an implementation process end to end. Obviously the actual, as Mudge went into, the actual on-site training is 2-3 days. But for making sure that we're vetting, we're loading all the appointments and going through the entire process, we typically say, let's take 6 weeks, make sure the staff is trained up, and we can get going. The next question that we had was actually more on the capabilities side, Mudge. How many of this, I guess everyone's curious about how many of the solutions that you looked at, because nobody goes through that process, but how many of the solutions that you looked at had capabilities of all steps of the journey? So when I say all steps of the journey, this person in particular is talking about pre-arrival and in clinic. But you know what? Why don't you add post-visit to that as well, just to make sure?
Yeah, so there's not many of them that do that. I only want to say there was like 2 or 3. The problem is you have things like, I can't remember if it was Frisia or another one that provided that, but the problem is you get ads, right? That was a huge issue. I don't want ads. I'm pretty sure that was Frisia, if I'm not mistaken, that was giving ads while we were going through it. I did not want to deal with that. I mean, this wasn't like, I don't know if how many of you guys are on YouTube nowadays, but I feel like there's like 3 ads per video or something crazy. I wasn't going to deal with that stuff. So I can't remember exactly how many, but there was a very small amount that went through that whole pre-arrival clinic post-visit process. Health iPASS was that one that we chose, and we stuck to it.
Okay, great. Well, the last question that I have is, it seems like a very COVID and an immediate care specific one. And it was, how did you handle COVID patients specifically in that journey? And were you guys able to do COVID screeners using Health iPASS?
Yeah, of course. So the screeners were definitely done ahead of time. We want to send those patients. And so with COVID, we actually don't want those patients in the rooms in our clinic. Obviously it's COVID, and I don't want that next to a patient who's just there for, some burn or, some kind of, urinary tract infection. And I don't want them going to the same room that I have a COVID patient. So we actually kept our COVID patients outside, which makes it quite tough when you're trying to get their insurance, when we're trying to get their, all their paperwork forms, and then the reminders done. And so it had to be very, very technology based here for our COVID patients, because we're doing a lot of telemedicine visits with them. But no one other than my staff who was going out there to test the patient was actually seeing the patient or really wanting to touch their forms, because we're having a lot of COVID positive patients, right? And so this was the solution to get it all done with kind of a minimal in-person interaction, more so for the other patients. You can only imagine if you go in to in a clinic and, your kid just wants a sports physical done at our clinic, and he's right next to a patient who's very potentially positive for COVID. I didn't want that in my waiting room. I didn't want that anywhere just from a safety perspective. And so that really needed a technology solution. And this was it. This is what we found, and we stuck to it. Obviously, it was the best option.
All right. Well, that concludes the questions that I have handy. I think it's fantastic. We can give 10 minutes back to everyone for their day. Thank you guys all for attending. We appreciate the time. Mudge, we really appreciate you taking some time to talk through the experiences of your practice on Health iPASS. And for any of those who are interested, you obviously can reach out to us. You can either request us on the Athena marketplace directly, and someone from our team will reach out to you. On top of that, if there are any questions or concerns, feel free to email myself directly. My name is Imran Ahmed, IMRAN at healthipass.com. And if there are any questions, obviously feel free to shoot them our way. But with that, we will conclude. Thank you all for your time, and looking forward to have more conversations with you all in the future.
I guess.